Are you tired of living with constant low back pain? In this video, you will learn an innovative, non-surgical solution for L5-S1 facet joint dysfunction that can significantly reduce your pain and improve your quality of life. Low back pain can be debilitating, literally affecting every aspect of your life. What if you could alleviate that pain without resorting to surgery? Many people don't realize that lumbar facet joints differ dramatically from the discovertebral joint. By the end of this video, you will have a clear understanding of the anatomy of lumbar facet joints, how they differ from the discovertebral joint, and why you have to approach therapies and treatments that are different from discovertebral joints, and why some therapies and exercises and protocols may not always fit every person's need. Understanding this information is critical for you to make the right treatment decisions and avoid many of the common mistakes that can often make low back pain worse. In addition to this information, I will share specific treatment strategies that go above traditional therapies and can offer real hope for people that are dealing with chronic low back pain from lumbar facet joint dysfunction. Stick around until the end of this video to learn 2 bonus exercises that are not only effective for L5-S1 facet joint dysfunction, but can also help people with herniated discs. I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. I dedicated this channel to providing you information about improving your spinal health and posture so that way you can feel better, move better, perform better, and have overall improved health. Before I dive in, take a minute to subscribe to this channel if you want to improve your spinal health and posture so that you can move better, feel better, perform better, and have overall better health. Let's take a deep dive into the anatomy of L5-S1. So this is L5, and this is the sacrum, or what we consider this is the first sacral segment, S1. As you can see, the lower you go in the spine, the larger the vertebrae become, and there's a reason for that. At the lowest part of the spine, these vertebrae, the sacrum, have to take on the weight of the entire upper body. So it's very important that these structures are in their optimal position and are functioning appropriately. So here in the front, you can see how the discs separate the vertebral bodies, and there's a disc, of course, that separates L5 vertebral body from the sacrum. So this is what's considered the discovertebral joint. That is not our focus today. The facet joints are out back. So here you can see facet joints. Now these joints, they have a joint capsule, just like your shoulder or your knee, and your body produces synovial joint fluid, which is a natural lubricant. So it's very important that we have proper position to allow for the joints to be in optimal position so they can transfer movement throughout the spine, but also support the weight of the spine. Now, it's very interesting. You'll see in this model, there is a curve. The ideal lumbar curve is a piece of an oval. It's not the same shape throughout the whole lumbar spine. Technically, it's a non-universal ellipse. So we have a little bit of curve up high, more curvature as we go low. And that allows for shock absorption because, again, this lower aspect of the spine has to absorb and distribute the weight of the entire upper body. So this curve is very important. And right here, if we have too much pressure, if the curve is not in the ideal position, so we're transferring more force into those facet joints, that will create excessive bone production as your body tries to stabilize those joints. And that is essentially how degenerative joint disease or arthritis of the facet joints occur. This can also happen with injuries if we overflex or overextend. That can damage the joint capsules, and that can break down the joints over time. One very important thing to take note of is the alignment of these facet joints. Can you see how they're rather vertical? So because of that, the facet joints limit how much rotation can occur on the lumbar spine, and they can really help to guide the lumbar spine through flexion and extension. So now that you know some of the basics about anatomy, let's talk about what do we need to do if we have inflamed facet joints that are causing pain, if we have some arthritis, degenerative changes to these joints, Essentially what we need to do is help those joints to move more smoothly, more regularly, in ways that doesn't put additional stress into the spine, into these facet joints. So it's kind of like the Goldilocks solution. We want to create some movement, but not too much, right? And as we talked about in other videos, many years ago, they would recommend bed rest for people that have back pain, but I talked about your body producing synovial joint fluid that is a natural lubricant. So bed rest is not ideal. That's too little movement because we're not circulating that joint fluid within the joint spaces. So you can look, based on the orientation of these facet joints, the best way to really encourage natural, normal movement, circulation of the synovial joint fluid, is to be doing micro movements that encourage flexion and extension. And again, we can't go overboard. We don't want to overly flex, which can damage facet joints. We don't want to overly extend, which can jam facet joints. No, we want more of a gentle milking action. And we can do some gentle rotation actions as well to promote some side-to-side motion. This doesn't have to be overdone because there's not a lot of rotation allowed in those joints because of their vertical position. So now we're going to get into treatment. What do we do to help these facet joints in our clinic? This is one of the things that sets corrective care chiropractors apart from traditional chiropractors and traditional physical therapists. Remember how we talked about the shape of that lumbar spine is very important. It really should resemble a piece of an oval, a non-uniform ellipse to be technically correct. So really, folks, if we have had injuries, past traumas, or postural faults over time, if we have short legs and we've lost that traditional alignment, while adjustments and exercises have value for improving short-term movement and improving the stability of the local musculature, if we've lost the ideal curve, that must be restored if we expect it to function optimally. So this is where the EAT protocol comes in. As corrective care chiropractors, we do traditional adjustments like a lot of people are familiar with, but then we have to add in mirror image exercises, mirror image adjustments, and as we talked about in other videos, mirror image traction if we need to restore and basically rebuild the proper curves of the lumbar spine. And that is so important because we can't expect the facet joints to function optimally if they're not in the appropriate position. Now, as we mentioned, there's a number of different things that can cause you to have a non-ideal lumbar spine alignment. And that's why true corrective care, like we practice in our office here and in other offices that utilize chiropractic biophysics, we really have to tailor the treatment to the individual patient. There really can't be a cookie cutter approach because some people might have a loss of the proper curve in the upper lumbar spine. Some people may have a loss in the lower lumbar spine. Some people might have a translation or a shift. And then we would have to devise EAT protocols that are specific to that person and their specific spinal deformity. So it's so important that if you have facet joint pain from facet joint dysfunction, that you get evaluated by a properly trained corrective care chiropractor. To find a corrective care chiropractor near you, go to www.idealspine.com. Okay, as promised, here are two highly effective exercises or stretches that can be good to reduce pain from L5-S1 facet joint dysfunction issues. The first one, you've seen it before because it can also be helpful for people with herniated discs. That is, and we'll demonstrate in a minute, supine or lying on your back knee to chest stretches. When you lie on your back and you perform knee to chest stretches, what we're doing is we're gently gapping those facet joints. That can help to work out inflammation, promote circulation of synovial joint fluid within the facet joint. And because you're lying down, we're taking the load and the gravity out of those joints. So here's what it looks like. Okay, we have Super CA Autumn helping us out with the knee to chest exercise. So it's really simple. Lying on your back supine, we can slowly bend the left knee. We can grab that leg, pull it towards our chest. We can make small little circles side to side. We can hold that for 10 to 20 seconds and then slowly release that leg. And then we can bring the other knee up. We can pull that knee into the chest. We can go side to side. We can hold that position for 10 to 20 seconds. Then we can release that leg, and then nice and slow, as long as it's tolerable, we can bend both knees, pull both knees towards the chest. We can make small circles in one direction and then the other direction. You can do 5, 10, 15 of these at a time. You can do them 2, 3, 4 times a day. Some people that have more acute pain, they get relief if they do this every hour. So the goal is to go nice and slow. We should never have any sharp pain when we're doing any exercise or stretch. If we do, we stop. That just means we're not ready for that particular stretch or exercise at that time. Okay, so this next exercise is very simple. All you need is a gym ball. You can get online, Amazon. You can get it from almost any local store. And what you do is you're going to drape your body over that ball, and then we're just going to rock forward and backwards. And then the shape of the ball will produce a little distraction to those facet joints. And then with the weight of the body over the ball, that can actually create some decompression, which can really help take pressure off of these facet joints, particularly if there's a lot of inflammation in the joints, perhaps if we have some arthritic change. So even folks that are almost bone on bone and they get a lot of pain whenever they are sitting or walking under the full load of gravity, this can provide a lot of relief. And I'll show you in just a moment how you can roll forwards and backwards. And that is also a great exercise for disc bulges and herniations as well. Okay, when you purchase your ball, they are sized. So look online. You should be able to find a ball that matches your relative height. This one's a little small for me, but it will get the job done in terms of demonstrating. So you set this ball in a safe place, make sure there's no sharp furniture to crash into, and then slowly you just roll onto the ball. And then if you roll up so your knees come off the ground, I can feel a nice little stretch. You can roll back. You can roll forward. You'll feel that in different areas of the lumbar spine. And you can just spend 30, 40, 60 seconds here. Nice distraction. You can do that again, 30, 40, 60 seconds if you will. Create some nice distraction. You can take a break. You can do 3, 4, 5, 10 reps at a time. Whatever feels good to produce some distraction. Take some of that pressure out of the spine that builds up when we're under the full load of gravity. I hope you found this video useful in managing L5-S1 lumbar facet joint dysfunction. Remember to optimize your spinal alignment by working with an aptly trained corrective care chiropractor. Hopefully you can find one in your area through idealspine.com. I'd love to hear from you. Please share with me any experiences you've had with L5-S1 facet joint dysfunction issues. Let me know if there's other topics that you would like me to cover. Please feel free to share this video with anyone who you think may benefit from watching it. Don't forget to subscribe to this channel so that way you can learn more about improving your posture and spinal health, so that way you can move better, feel better, perform better, and have overall better health.